All right, and so to finish off this first segment of talks, we have another UCB sponsored segment focused on treatment of Dravet syndrome from Beck Reyes, who is based at UCLA Mattel Children's Hospital.
Hi, everyone. My name is Beck Reyes. I am a nurse practitioner at the UCLA Mattel Children's Hospital in Los Angeles, California. And when I had the opportunity to come out to the Mall of America, I said, sure, right away. I'm there. And I actually brought my 12-year-old son, who's now probably riding a roller coaster as I'm talking to you all today. But I'm really excited to be here on behalf of UCB because I get to see a lot of patients with refractory forms of epilepsy, such as Dravet. And let me tell you, you are already one step ahead. The fact that you're here, and for those of you that are listening at home, you have the opportunity to learn about different treatments so that you can have meaningful conversations with your healthcare team and really be a partner in the management of your child or loved one with Dravet syndrome. So today, I'm going to talk about Fintepla. It's a great treatment option for patients with Dravet. So some important information is that it is indicated for individuals with Dravet or Lennox-Gastaut syndrome, and it's been found to be effective in patients as young as 2 years of age. So it hadn't been studied in patients less than 2 years of age, so we can't really comment on the safety and effectiveness of children under the age of 2, but for children over the age of 2, it's indicated because we studied it in children as young as 2 years of age. When using Fintepla, there could be some serious side effects, and so that could be some side effects associated with the valves in the heart or high blood pressure in the arteries of the lungs. And so we're going to talk about this in more detail, but it's certainly something that you should think about when you're thinking about Fintepla for your child or for your loved one. So some facts about Fintepla. So it's a twice-a-day liquid medication. It's cherry flavored, however, it is compatible with ketogenic diet. So if you have a child that's on ketogenic diet, they can be on Fintepla and you won't have to worry about it doing anything to the ratio or any changes to their regimen. It's compatible with feeding tubes, so that's great. If your child or your loved one has an NG tube or a G tube, they can certainly use Fintepla without any issues, and you won't have to worry about it being compromised if you put it through a tube. I know, for some folks and some pharmacists, they worry if you, say, crush a tab, mix it with water, put it in through a tube, then it compromises the way in which your child absorbs that medication. But when they're on Fintepla, that's not something that you're going to have to worry about. And there are no dietary restrictions, once again. So if your child is on a diet other than ketogenic diet, then they certainly could have Fintepla as well. Fintepla can be added without making changes to current anti-seizure medications. So that's really great. You won't necessarily have to worry about lab tests that are associated when you add Fintepla on as treatment. And you won't necessarily have to worry about how it's going to impact your child's current anti-seizure regimen. The only caveat with that is if your child is already on stiripentol, you won't necessarily have to make changes to your stiripentol dose, but that just lets your healthcare team know that they may have to make adjustments to that Fintepla dose. Fintepla offered profound seizure reduction in patients with Dravet syndrome. So during that clinical trial period, Fintepla reduced monthly seizures by 79% compared to placebo, which was only about 16%. And that was when Fintepla was added on to that patient's current treatment regimen. So they might have been on multiple anti-seizure medications before trying Fintepla. And also, Fintepla offered more seizure-free days in patients in Dravet syndrome. So in the clinical study, 50% of patients taking Fintepla had a seizure-free streak lasting at least 21 days. That can be significant for you because those seizure-free days means so much, especially when your children are missing school because they had a seizure. They're too tired to go the next day. They can't participate in the therapies that they normally would because they're having seizures and they're just too tired to participate in them. In the long-term results in patients with Dravet syndrome, we have some findings here. So past the clinical trial period, then the patients could decide whether or not they wanted to move on to an open label study. And so 94% of patients continued with Fintepla, and they participated in the open label extension study, meaning that they knew that they were receiving Fintepla. And 64 of these patients experienced 50% seizure reduction. 41% of these patients experience greater than 75% seizure reduction. Some common side effects that are associated with Fintepla. So the most common side effects are decreased appetite, diarrhea, low energy, respiratory infection, decreased weight, fever, constipation, an abnormal echocardiogram, sleepiness, some problems with movement or balance in walking, some increased drooling, increased blood pressure, vomiting, falls, seizures that didn't stop, and weakness. So these aren't all the possible side effects. If you note that you're on Fintepla and you notice anything else, then it's important to let your healthcare provider know. So let's talk about REMS. So REMS is a risk evaluation and mitigation strategy program that was developed by the FDA, and that is for the safety of your loved one. So back in the 1990s, Fintepla, or fenfluramine rather, which is the active ingredient, in combination with another medication called phentermine, was on the market as something called fen-phen. So for those of you that remembered this weight loss craze, fen-phen was all the rage, very similar to what's going on with other weight loss drugs. And a lot of folks that may not necessarily have not met the criteria for being on it were on the medication. It was used in much, much higher doses than what is being used to manage the seizures associated with Dravet syndrome. You also want to keep in mind, at the time when it was used for weight management, these patients had a lot of other comorbidities. You can imagine in an obese patient, they may already had comorbidities like diabetes or heart disease, all sorts of comorbidities which could cause valvular problems. And so because there is this history of that being a problem with that combination of medication, when Fintepla was coming to market, the FDA really wanted to make sure that any of the individuals that were taking this drug were safe to be on this drug. And that's part of the reason why they would have to participate in this REMS program. So with the REMS program, that would mean that if your loved one were to start Fintepla, they would have to do a baseline echocardiogram, which is an ultrasound of the heart, and then they would have to do it every 6 months thereafter so that we could pick up on any valvular changes or any changes in the pressures of your loved one's heart, and then the decision can be made on whether or not that's too much of a risk for your child to be on that medication. So that's part of the reason why if your child were to start something like Fintepla, then they would have to be closely monitored by this FDA-mandated program. And so again, it would happen at the beginning of treatment, so prior to actually starting treatment, and 6 months thereafter. And then if your child has to come off of the Fintepla, we'll also do one last echo to make sure that their heart is working perfectly at the time of cessation of that medication. So in the clinical trial studies, it was studied in 341 patients with Dravet syndrome and 262 patients with LGS. And so those patients, we checked on their hearts. They got serial echocardiograms every 6 months. And none during the clinical trials had developed any issues with the valves of the heart or any high blood pressure in the arteries of the lungs. So it's a really well-studied safety profile. And at this point, more than 2,000 patients have been treated with Fintepla, some for more than 5 years now. So if you have any questions about Fintepla, and you can certainly reach out to the nurse educators that are provided through UCB, you can certainly do so now. I know this is kind of a little snippet about some information regarding this medication, but if you have any more questions, you certainly can reach out to a clinical nurse educator that's available to you to ask your questions, so that if this is something you want to pursue with your healthcare team, then you have the answers from the clinical nurse educator, but you also have the opportunity to ask your healthcare provider, hey, I got to learn more about this. Could you answer this? They also are great about preparing you for conversations with your loved one's healthcare provider. Oftentimes, I tell my patients before the next visit, before you come to see me, write down those questions, write them on a little notes tab in your phone, because I know that during that time with me or with your healthcare provider, we talk about so many things you might forget. Gosh, I forgot to talk about that possible treatment. You can discuss results of the Fintepla clinical trial studies and what that might mean for your family. They can answer your question about the REMS program. So logistical questions, things that you might have. Gosh, how can I get an echo? Will it be covered by insurance? What happens if I can't find an echo center in my area? So they would be able to help answer those questions as well. And then lastly, they'll be able to educate you on financial support programs. And it allows everyone to have access to Fintepla treatment and echo tests that are needed when you go along with this treatment. So we're going to talk about some important safety information. Fintepla is a prescription medication. Again, it is indicated for individuals with Dravet or Lennox-Gastaut syndrome in individuals as young as 2 years of age. We've talked about this, so just in review, Fintepla could cause problems with the heart valves in the heart. If your child develops any of these symptoms, shortness of breath, tiredness or weakness, lightheadedness, swollen ankles, chest pain, sensations of rapid fluttering heartbeat or palpitations, or any cyanosis, which is the bluish color around the lips, then it's important to let your healthcare team know. Also, some important safety information: decreased appetite and decreased weight. So that was found when taking a Fintepla. It's important to note that your child or your loved one is going to be monitored during their visits, and so their weight should be monitored, making sure that they're growing appropriately. Sleepiness, sedation, and lack of energy are also a potential side effect. This is a class warning for all anti-seizure medications. Just like Fintepla, it can cause suicidal thoughts or actions. So it's important to let your healthcare team know if they have any new onset of these types of thoughts. I've had patients that have said, I have dark thoughts, and so that definitely clues me in that perhaps they're having some thoughts because they've started this medication. You shouldn't stop Fintepla without letting your healthcare provider know. You know this at this point. There is a gradual taper off of a medication. So if at any point Fintepla needs to be stopped, then it would have to be tapered off. It couldn't abruptly be stopped. If you're taking MAOIs or any SSRIs, SNRIs, antidepressant type medication, it's important to let your healthcare team know, because in combination with Fintepla, it can cause something like serotonin syndrome. So if that's being taken, it's important to let your healthcare team know. Again, if you have any symptoms of, if you have a history or your child has a history of any heart problems, weight loss, depression, mood problems, suicidal thoughts or behavior, kidney problems, liver problems, you would definitely let your team know so that you can make an informed decision on whether or not Fintepla would be appropriate. This is an important thing that it's important to let your team know, is if, in addition to over-the-counter medication, if you're taking any vitamins or supplements, if your child's taking any vitamins or supplements, it's important to let the team know, because it may interact with the medications that they're on. you should avoid, or your child should avoid taking Fintepla. Obviously, they're not operating vehicles at this point, but before participating or engaging in anything that could potentially be dangerous, it's important to let the team know. We had talked briefly about serotonin syndrome, but these are some symptoms. If there are changes in mental status, changes in blood pressure, tight muscle, fast heartbeat, nausea, vomiting, diarrhea, high temperature. It could also cause high blood pressure or hypertension, so it's important to monitor those things. It can cause an increase in pressure in the eyes or glaucoma, so if there are any signs or symptoms of glaucoma, it's important to let your healthcare team know. Again, we had talked about this, but really briefly, these are potential side effects of Fintepla, and that's specific to Dravet syndrome on the left-hand side and LGS on the right. So let's see what's possible with Fintepla. It's FDA approved in the treatment of seizures associated with Dravet syndrome in patients as young as 2 years of age. It can be added on to their current treatment regimen without having to make any changes. Fintepla offered profound seizure reduction in patients with Dravet syndrome, and it's got a really well-studied cardiovascular safety profile. And so during the clinical trials, there have been no instances of heart valve problems or problems with the arteries of the lungs to date. Fintepla is available by prescription, so feel free to talk to your healthcare providers to see if it's an appropriate medication for your loved one. UCB is here during the entire weekend, so if you have any more questions, the medical team from UCB is also here. Feel free to visit the booth, write down your questions, and then check us out. So with that, I'm going to pause right here. If there are any questions. Right here.
Hello.
Hi.
I apologize. English is not my first language. First question. You say something about taking vitamins. So let's say my daughter's taking Fintepla, and her weight decrease. What type of vitamins do we need to be aware or careful if our loved ones are taken? And the second question is there any other studies doing for Dravet syndrome and Fintepla, let's say different dosage, something else? Thank you.
Okay, so first question is regarding vitamins, and could there be potential vitamins that can be taken to help with weight management? I don't know of any vitamins, but I will say that if you know that your child is deficient, like say they're really picky and they don't eat a lot of vegetables, then you could take a multivitamin, because that just means that your child doesn't have a nutritionally complete diet. That's a great question for your healthcare team, and I'm kind of like walking the line here because I actually happen to be a healthcare provider, but I would say that, if you have a child that has a nutritionally deficient diet, certainly a multivitamin can help support making sure that they're meeting the daily recommended intake for those things. Now, for the weight management, that's something you discuss with your healthcare team. So imagine that your child is plugging along at the 25th percentile, and for some providers, they might say, okay, like a 10% drop might not be a big deal, or it might be a big deal. And at a certain point, we're gonna have to decide, would it be appropriate to make a reduction in the medication? Or would it be appropriate to try other strategies to help maintain weight? I'm gonna veer off slightly because I happen to actually manage the ketogenic diet program with the patients that I work with, but that might mean that they might need additional calories elsewhere. That might mean that your healthcare provider might have to refer them to a dietitian to really look at the diet to just make sure that there isn't too much weight loss. Again, the risks and benefits depending on how much seizure control your child has. The second question, I think, was it with dosing with...
If there is any study coming or something different based on the dosage that is like normally recommended.
Right, okay. So what you'll find is that the recommended dose is 0.7 milligrams per kilogram per day, divided twice a day. And so that would be considered the max dose, or 26 milligrams per day would be considered the max dose a person on Fintepla would be on. For the patients that were, on fen-phen before, their doses were much, much higher. And so that at that point, that would be a decision that you would make with your healthcare team, like where is the appropriate dose range that would be appropriate for your child. But that's how it was studied. So the max dose would be weight-based dosing. It would be 0.7 milligrams per kilo per day until your child or your loved one has reached 26 milligrams. Then that would be the max recommended dose.
Hello, hi. A question. Do you know what percentage of children between the ages of 2 and 3 were studied initially, and maybe part of the 2,000 children who have subsequently been placed on this medication?
Yeah, that's a great question. I don't actually know off the top of my head how many children or the percentage of children in that particular age range.
Hello.
Hi there.
Our daughter started on Fintepla in December, and from day one, she was 1 month seizure-free. But she had side effects, and we had to lower the dose. And every seizures, all the balance are back, and she's seizing daily. In the meantime, we weaned off Diacomit, ramped her up, doubled the dose, everything. So 2 questions. How would you explain this seizure-free period stopped suddenly by just lowering dose? And second question, how long to wait till we can tell that it's not for her, the medication?
Yeah, so that's a great individualized question. So the first part is that at higher doses, your child had more seizures, and then the dose was reduced, and then there was a 1 month period of seizure freedom.
She started day 1, no seizures for 1 month.
Oh, when you started Fintepla.
So immediately when she started from day 1, she was seizure-free for 1 month. But she got lots of side effects, and we lowered the dose to half, and all seizures came back.
So you lowered the dose to half, and she had no seizures?
No, all seizures came back.
All the seizures came back. Yeah, that's really tricky because it's a fine balance between the effective dose and the side effects that might be associated with the higher doses that are required to reduce the seizures. And so sometimes, that's a good question for your team on, whether or not other treatments needed to be added on, or could there be other things that we could do to manage the side effects that were associated. So the time frame and how you would, so again, that's a great question for your healthcare team. However, so in my practice, I would say about at least 3 months, we typically give a treatment option, a trial period, before we decide that it may or may not be effective in that particular patient.
Are there studies looking at hypermetabolizing of Fintepla, or a way to check the therapeutic levels to ensure patients are receiving appropriate dose outside of the weight alone?
Oh, I see. I don't know in the clinical trials if we have we're talking about like serum therapeutic range, right? I don't know actually off the top of my head, and maybe some of my UCB colleagues can answer that question, but I don't know that there was an established therapeutic serum level for Fintepla.
Okay, my question is, for those of us who have children on Belviq or Lorcaserin, we've heard that it's going to be discontinued and that Fintepla is the drug of choice to convert to. Do you have any information yet on how the conversion has gone for these patients? And I got a phone call from a company called Onward. Is that a division of UCB that is monitoring this?
Okay, so great question. I'm not sure what the transition plan is. However, Onward is a program that is developed with UCB, and so they can answer those questions just like the nurses. That they are available through Onward, and so it's a patient assistance program, and they're a really great program that can talk to you about what the transition is going to look like. Again, if you have any financial questions, if it's issues with insurance, the Onward program through UCB is that patient assistance program. So they're with Fintepla, yeah. Hi there.
One question regarding the carbohydrate content of this drug. This might be important with the use of the ketogenic diet, how much carbohydrates are inside. And it's a liquid and it has cherry flavor, so how much carbohydrates are inside this product? Thank you.
That's a great question. So I don't know the amount of carbohydrates off the top of my head, but I do know it's less than 1 gram. But I'm not sure off the top of my head how much carbohydrates are in the liquid suspension.
Hi, I have a question about the research being done or patients that you've talked to that have adult kids. My son is 26. He is about 5'10". He weighs about 180. He's intense. We run towards mania like about every month, 6-week cycle, and he's already on 3 psychiatric meds.
Yeah, that's a great discussion that needs to be had, and sometimes we have to partner with our psychiatrists, especially when they're on these anti-seizure medications, to determine if it would be appropriate to have that person on something like Fintepla, and in combination with SSRIs or SNRIs. It's a fine balance, and that's something you definitely need to partner with your child psychiatrist on.
All right, we're out of time for questions, but I just want to remind everybody that UCB has a large team here. They have tables in the exhibit hall. They can answer questions both about this presentation as well as the one just before. If you have more questions about, I know there were a lot of questions about the trial data, come talk to them. That's all they can do is share what the trial data is, but their team can have additional conversations with you throughout the conference. Thank you so much.
Right. Thanks, everyone. Thanks for having me.